Hi, welcome to this VetSpoke webinar. My name is Sandra, and today we will discuss about how to treat feline lymphoma. So we will start giving a brief overview about this cancer in cats. So lymphoma represents up to 30% of all the feline tumors, and we do see a breed predisposition, especially in Siamese cats and Oriental breeds. We also have very strong risk factors for this type of cancer, with feline viruses playing an important role, especially feline leukemia virus, but also feline immunodeficiency virus, with up to 10 to 60-fold more risk in cats being positive for those viruses. In contrast to the canine lymphoma, we see that in cats there is a variety of anatomical presentations, including alimentary lymphoma, which is probably the most common right now, mediastinal form, multicentric lymphoma, which is the most common presentation in dogs, while in cats it seems to be much less common. And then we will have an extranodal presentation in cats, which will include renal lymphoma, nasal lymphoma, even ocular lymphoma or cutaneous lymphoma. So as general considerations, what do we do when we have a diagnosis of lymphoma in a cat or a high suspicion of lymphoma? So normally we would start with a diagnostic workup, which will include full hematology, biochemistry, and urinalysis. We do sometimes see hematological abnormalities in these patients, including anemia, thrombocytopenia, or other cytopenias. Also, the biochemistry is going to be important to assess mainly renal function, hepatic function, especially if we are considering future treatment for that patient. And urinalysis and total T4 is normally also part of the workup, especially in adult to elderly cats. FIB, FELB status is going to be important if we don't know that, to test for it, especially in those forms where there has been a stronger association between those viruses, which is the multicentric form and the mediastinal form. And ultimately, we will also perform imaging investigations to assess the extent of the disease, and this will include thoracic radiographs and abdominal ultrasound. Bone marrow biopsy may need to be considered in some cats, especially if, as we were saying before, there are cytopenias in the hematology, or if we have a suspicion of leukemia. That could be really useful. Apart from that, the diagnosis is going to be made most of the times on cytology. Sometimes we may need a biopsy if the cytology is not giving us a definitive answer. And definitely we have other techniques, which I'm not going to go in depth into those, but other techniques such as immunohistochemistry, immunocytochemistry, flow cytometry, and PAR can definitely be useful tools also for diagnosis of these patients. So once we have our diagnosis and our cytology report or histopathology report states that that cat has a diagnosis of lymphoma, we have to always remember that this is a systemic disease per definition, and is a lymphoproliferative disease, and therefore chemotherapy is going to be the treatment of choice in the vast majority of patients. Compared to canine lymphoma, lymphoma in cats is considered more challenging to treat and a little bit more frustrating to treat as well. Normally, the responses rates to chemotherapy are considered lower compared to dogs, and also the remission duration is generally shorter. Obviously, this will depend on each form of lymphoma. But in general lines, the available information also for prognostic factors is a bit more limited compared to dogs. There are some negative prognostic factors that have been reported, such as feline leukemia virus positivity. So we know that these cats, unfortunately, they tend to get more complications during treatment, and therefore the prognosis tends to be more guarded. Also, cats that have severe clinical signs, such as severe weight loss, anorexia, lethargy, they tend to also have a more guarded prognosis. And normally we tend to see this, especially with renal lymphoma, gastrointestinal lymphoma. This tends to be quite common. But in general lines, the most important prognostic factor is going to be the response to therapy. So this is something that we will keep a close eye on, especially during the first month of treatment, and we will reassess the response to treatment normally 3 to 4 weeks after starting chemotherapy, because we know that those cats that will achieve a complete remission, they will generally have a more prolonged survival and a better outcome. Obviously, there are other treatments such as radiation, electrochemotherapy, and surgery that we may consider in selected cases, especially for localized forms such as nasal lymphoma, for example. So the next question is going to be, which chemotherapy protocol do I use when I have a diagnosis of lymphoma in a cat? And here in this table you can find a summary of the different first-line protocols that have been described for feline lymphoma. Personally, the one I use is the COP protocol, and normally I use high doses of vincristine and cyclophosphamide for a period of 6 months. This protocol has shown a response rate of 75% and a median response duration of 8 months and a median survival time of 9 months. You will see also the CHOP as a commonly referred protocol also for feline lymphoma. This protocol adds doxorubicin on top of the vincristine and the cyclophosphamide and may achieve also similar outcomes. Despite these protocols and the differences in the drugs, it's also important to take into consideration that the patient population was very heterogeneous, so it's very difficult to compare those studies among them. The COP protocol is probably one of the most widely used protocols to treat feline lymphoma, and as we said before, it combines vincristine, cyclophosphamide, and prednisolone. This protocol achieves complete remissions in 47 to 79% of the cases, with a median duration of this remission of 83 days. As you can see in this table, the protocol is summarized and it consists of weekly treatments for the first 4 weeks, and then treatments are given every 3 weeks thereafter for a total period of 6 months. So, and you can see that the prednisolone is started at 2 mg per kg SID, then is reduced to 1 mg per kg SID, and then is given every other day till the end of the protocol. So the cost normally for this type of treatment is of approximately £2,000 to £4,000, but obviously these may vary depending on the hospital. So an alternative protocol to the high-dose COP would be the CHOP, that basically adds the doxorubicin on top of the vincristine and the cyclophosphamide. However, CHOP protocols in cats are slightly controversial because we know that doxorubicin as a single agent has very low response rates in cats of around 20%. So apart from that, is a well-tolerated protocol, is very similar to the protocol that we would use as first line in dogs. It can last from 19 to 25 weeks in total, the protocol, but there is no need of maintenance after completing the protocol. So once we have finished those 19 or 25 weeks, we stop there, providing that the cat is in complete remission. Interestingly, there was a study by Taylor et al. That found no difference between remission rates between a COP protocol and a COP plus methotrexate and doxorubicin plus minus L-asperginase, with one protocol achieving remissions in 72% of cases versus 64%. But what do we do if the owner cannot commit to weekly treatments at the beginning, or simply doesn't want such an intensive protocol? So we do consider doxorubicin single agent protocols in dogs with lymphoma that are given every 3 weeks, for example. However, as we just mentioned, in cats, because the response rates are lower, normally that's not recommended as a first line treatment. We can use doxorubicin or epirubicin at 1 mg per kg to intensify the COP and the CHOP protocol, especially when we see that there is not a complete response or that the cat has not achieved not even a partial response. So in these cases, we would add that after the induction phase, normally at the week 3 or 4. Interestingly, in cats, we don't tend to see cardiac toxicity in these situations with the use of epirubicin or doxorubicin. But we do monitor the renal parameters closely because we do tend to see increases in creatinine with cumulative doses. Also, we can consider L-asparaginase. L-asparaginase is an enzyme that basically has lympholytic activity, and it can also have a tumor response in up to 30% of the cats. So in cats, it's going to be very important to monitor the response to treatment, especially because we do often see that these cats present with extranodal forms, either gastrointestinal lymphoma, mediastinal lymphoma, renal lymphoma. Unfortunately, the response can only be assessed by repeating imaging in a lot of cats. So restaging, meaning repeat ultrasound or repeat thoracic radiographs, is going to be important to see if the drugs are actually working. So that's something that we will always recommend normally after 4 weeks of treatment, once the cat has received all those weekly chemo drugs at the beginning of the protocol. So here we have, for example, an example of a cat with mediastinal lymphoma, where we can see this large soft tissue opacity and masses around the tracheobronchial area in the X-ray on the left-hand side, while on the right-hand side, that X-ray looks completely normal. So we cannot see that lymphadenopathy around the tracheobronchial area or that cranial mediastinal mass anymore. So repeating imaging will help us not only to assess the response, but also to decide whether that cat needs a change in protocol or maybe an intensification of the current protocol. So unfortunately, despite the COP or CHOP protocol, we will eventually see that most cats will relapse at some point and the lymphoma will come back, and then is when normally we have to consider a change in protocol. Normally, we mention those protocols rescue protocols. This means that the aim of these protocols is to bring the lymphoma back into remission. One of the protocols that we often use is lomustine single agent or combined with other drugs. So here we have the LMC protocol, which was one of the protocols that we were commonly using both in Liverpool and the Royal Veterinary College, and it basically combines the lomustine with methotrexate and cytarabine. Other protocols, such as the DMAC protocol, have also been reported, and this particular protocol combines melphalan with actinomycin D and cytarabine together with dexamethasone, and showed a response rate of 26% and is also well tolerated. You will find in the literature other protocols such as the LMP, MOP, MOMP. These protocols in general lines, what is important to tell the owners is that unfortunately the response rates to rescue protocols in cats are much lower compared to dogs, where normally we achieve responses in 40 to 70% of dogs. In cats, in general lines, those rescue protocols tend to be much more rewarding. It's always important to remember and explain to the owners that the aim of chemotherapy is to control the lymphoma for a period of months to years, depending on the type of lymphoma, and that chemotherapy is generally well tolerated in cats. However, it's important to discuss that the side effects that could happen and how we would handle those. In general, the most common side effects are gastrointestinal, such as lethargy, vomiting, diarrhea. We can see sometimes anorexia in cats. Those tend to be a little bit less common than in dogs. And we do often see also neutropenias, which are expected, I would say. Obviously, we are not willing to cause a severe neutropenia that could be life-threatening or make the animal prone to infections, but there is going to be always a degree of neutropenia if we expect the chemotherapy to work. And in most cases, this will eventually resolve and will recover after a few days. Also, it's important to remember that some cats will lose the whiskers. We don't tend to see hair loss, but the whiskers may fall off. And when these side effects happen, obviously we try to manage the patients on outpatient basis whenever we can and treat them at home, either with antiemetics, with appetite stimulants, or sometimes with antidiarrheals. As we said before, the quality of life in these cats is going to be our priority. And even if we cannot completely control the cancer, we want to preserve that. And it was very interesting, this study that was recently published, where they did a survey of 31 owners that had cats that had been treated with a COP chemotherapy protocol. And that study showed that 83% of the owners were happy with how their cats coped during the protocol and the quality of life that they had during treatment. And more importantly, 87% of these owners would treat another cat with chemotherapy after having gone through that experience. In that study, they also found that one of the most important factors for the quality of life of these cats was the body weight, together with the appetite, the general activity, the grooming, and the playfulness scores. So these are the key things that the owner should pay attention to and monitor during treatment. You can see also in this graph how before diagnosis the quality of life scores were around 9.5. At diagnosis, obviously these decreased significantly to an average of 2 to 3. And then during chemotherapy protocol, these quality of life scores went back up, unfortunately not as high as they were pre-diagnosis, but definitely there was a significant improvement in those quality of life scores. There are other considerations that we need to take into account when treating cats with chemotherapy, and one of these is going to be the stress levels, which in general lines we tend to see that they are higher compared to dogs. So to minimize this stress, there are several things that we can do. One is to use small clippers like the ones here on the slide that basically they reduce the noise and they obviously don't scare these cats as much as the big clippers. We tend to use pheromones as well. Feline tends to work quite well. You can spray that around the table where you're going to administer chemotherapy, or just have one of those plug-in feline. We tend to use also topical anesthesia with EMLA cream, and then we apply a bandage around it and we leave it for around 30 minutes to 1 hour to try to anesthetize a little bit the area at the time of placing the catheter. In cats where we see that placing catheters can be challenging, we can consider vascular port accesses that facilitate administration of chemotherapy. Unfortunately, this would require a small surgery and a general anesthetic. And in cases where we see that it may not be completely safe to administer the chemotherapy consciously, we may need to sedate them. Also, apart from reducing the stress, it's important to select the patients adequately. So it may be that not all the cats that are diagnosed with lymphoma are appropriate candidates for intravenous chemotherapy. So obviously it's good always to discuss with the owner in these patients alternative options such as oral chemotherapy maybe, or other palliative treatment options. So that's definitely something that we always take into consideration depending on the owner's expectations and how the patient is in the hospital environment. So we briefly mentioned other treatments such as radiotherapy, surgery, and electrochemotherapy for cats with lymphoma before. I just wanted to specify a little bit in which cases we would consider this type of treatments. In general lines, radiotherapy is definitely a really good alternative for solitary lymphomas, for example, nasal lymphoma, where we see that those patients can have a survival time of 2 years. And definitely is a radioresponsive tumor. So for these localized forms where the lymphoma, we see that there is no evidence anywhere else, or that there is no lymphoma in the local regional lymph nodes, is worth considering this option. Other forms of lymphoma where it has been reported radiation as a treatment is mediastinal lymphoma and gastrointestinal lymphoma. Surgery may be considered in very, very specific cases, for example, for solitary cutaneous forms, or sometimes we've used surgery as well to treat Hodgkin's lymphoma, where a solitary lymph node is enlarged. And there is more and more evidence now for electrochemotherapy also to provide a response for patients with solitary lymphoma, especially cutaneous lymphoma as well. So that could be also a treatment option to consider. So before finishing, I just wanted to discuss a little bit more in depth certain subtypes of lymphoma and discuss some peculiarities of each of these forms. So we will start with alimentary lymphoma, and we will see how important is, especially in cats, to individualize the treatment protocol to each case. Gastrointestinal lymphoma is definitely one of the most common forms we see of lymphoma in the hospital, and we actually have evidence for the incidence of this subtype of lymphoma to have increased from the pre-FELV area to the post-FELV area, and the estimated incidence right now is of around 72%. Normally, this form of lymphoma will most commonly involve the small intestine, but we can definitely find also evidence of lymphoma in the stomach, large intestine, and sometimes involving the mesenteric lymph nodes and liver and spleen. In general lines, there are three types of gastrointestinal lymphoma that we can differentiate based on the morphology of those lymphocytes under the microscope. So low-grade lymphoma or lymphocytic lymphoma will basically have a predominant mature population of lymphocytes, while intermediate to high-grade lymphoma or lymphoblastic lymphoma will have a predominance of lymphoblast. Then there is this third subtype that is a little bit more peculiar, that is called large granular lymphocyte lymphoma. And this subtype of lymphoma is characterized by having granules that normally are very magenta granules, quite thick in the cytoplasm. And this subtype of lymphoma also is characterized for having a very poor prognosis, unfortunately. Normally, the diagnosis of these cats can be a little bit challenging because we do see that sometimes it's difficult to distinguish between lymphoplasmacytic inflammations and low-grade lymphomas, and we often need to get a full thickness biopsy to be able to get a definitive answer. And an alternative obviously would be to get endoscopically guided biopsies, but unfortunately we often see that those samples are too superficial and cannot provide a definitive answers. So in these cases, PAR is definitely a molecular test that we may consider. So in this table, we can see how the lymphocytic form of gastrointestinal lymphoma differs from the lymphoblastic form. In terms of surgery, in both subtypes, it may be something useful, especially at the time of obtaining a diagnosis. For lymphoblastic gastrointestinal lymphomas, we tend to see that these cuts may present with intestinal masses more often. And if we see a complete obstruction of the intestine, or sometimes this mass can rupture and cause a peritonitis, surgery definitely will also be indicated, and we will consider an enterectomy there. In terms of treatment, chemotherapy is normally the first-line treatment for both types of lymphoma. Normally, if that cut has had an intestinal mass resected, we will wait between 10 to 14 days before starting chemo. But the drugs are going to be different. So for lymphocytic lymphoma, we tend to consider chlorambucil and prednisolone, which are given as tablets at home. While for lymphoblastic lymphomas, because they are more aggressive, we tend to treat with high-dose chemotherapy, either with a COP or CHOP protocol. If the owner is not considering those type of protocols, then lomustine or MOP protocols can also be an option. And radiation has also been reported either as a consolidation after chemotherapy or in the relapse setting. In terms of response rates, these are going to be higher for the lymphocytic form. Around 75 to 90% of cats will achieve a remission, while for the lymphoblastic form, this will be lower, around 50 to 60%. And the outcome is going to be very, very different. While for the lymphocytic form, we expect those cats to be alive after 2 years or more. Normally for the lymphoblastic form, the prognosis is quite poor, and those median survival times tend to be in the region of 6 to 10 months, depending on the response that the cat has had to treatment, with only 40% of cats alive after 1 year. In addition to chemotherapy, supportive treatment in cats with gastrointestinal lymphoma is going to be very, very important, especially because we see that these cats either present with protein-losing enteropathies or with a history of weight loss, anorexia, and normally they are in a poor body condition. So parenteral cobalamin supplementation will always be considered, especially in those lymphomas that are located in the small intestine, and we know that the cobalamin is absorbed in the ileum. So if we have a suspicion that the lymphoma may be involving the ileum, it's worth checking the cobalamin levels because they will often be below the threshold. Obviously, nutritional support also is going to be part of the treatment, and in those cats that have had a significant weight loss, we may consider placing an esophagostomy tube or change the diet to a more energetic, caloric diet, but at the same time highly digestible and palatable, because obviously those cats, especially during the first weeks of chemotherapy, they may not feel very well and not very keen to eat. The steroids may definitely help improving the appetite, and these are part of the chemotherapy protocol. So those tend to be given at quite high doses at the very beginning and also may help with the appetite. But if that's not enough, we can consider other drugs, other appetite stimulants such as mirtazapine, ceprotectin, or if we see that the appetite loss is associated to chemotherapy side effects, we can treat that nausea or that stomach upset with, for example, maropitant. We are now going to talk about mediastinal lymphoma. Mediastinal lymphoma is now the second most common form of lymphoma that we see in cats, and since the prevalence of feline leukemia virus has decreased over the last decades, we have seen that the incidence of this form of lymphoma has also decreased, and it's considered now to be less than 15%. We typically see this form in young cats with a median age at diagnosis of 3 years, and Siamese are again overrepresented also for this form of lymphoma. Because this form was initially associated to feline leukemia virus, it's always important to check that and have that information when we have a diagnosis of mediastinal lymphoma. And normally, as a result of this mass in the thorax, what we will see is that these cats, they typically present with pleural effusion and signs of respiratory distress such as dyspnea, tachypnea, and normally they can have also a compression of the trachea and signs of cough. So this is probably one of the largest studies that has been published looking at feline lymphoma in the mediastinum, and it was published in the Journal of Feline Medicine and Surgery in 2014. And the results were very interesting. They looked at cats with mediastinal lymphoma that had been treated with chemotherapy as well, and they found that 95% of cats responded to chemotherapy, which is probably a higher response rate compared to other forms of lymphoma. And they could not find any difference in remissions between COP and CHOP protocols. Overall, the median survival time in that study for those 55 cats was 373 days, which is roughly a year. But they did see that cats that had achieved a complete remission lived longer, with the majority of them that had responded living over 2 years. And also one of the findings that was quite interesting is that they didn't see any changes in survivals in those cats that had been treated with glucocorticoids, which is a well-known poor prognostic factors for canine lymphoma. We will now move on and talk about nodal lymphoma. Nodal lymphoma is considered uncommon in cats and has been associated with feline leukemia virus infection. So again, it makes sense to test these cats for feline leukemia virus and immunodeficiency virus at diagnosis. There is also a rare form of nodal lymphoma called feline Hodgkin's-like lymphoma. And these cats typically present with one or more than one lymph nodes enlarged around the cervical region. Normally submandibular, retropharyngeal, or prescapular lymph nodes tend to be involved. So this subtype of lymphoma is characterized for having a peculiar cell on histopathology that is called Reed-Sternberg cells. In general, the treatment for nodal lymphoma will involve chemotherapy, COP or CHOP protocols, but it's true that for this type of Hodgkin's-like lymphoma, surgery is definitely something we would consider, and both for diagnostic and therapeutic purposes. Lastly, we will talk about extranodal lymphoma. The extranodal form of lymphoma involves different types and anatomical forms of lymphoma, and one of those is going to be nasal lymphoma. These cats, they typically present with stage 1 disease, meaning that the lymphoma is only within the nasal cavity, but is obviously worth staging and making sure that the lymphoma is not anywhere else. And the typical clinical signs of these cats will be sneezing, epistaxis, and as you can see in this picture, sometimes facial asymmetry or involvement of the subcutaneous tissues can also happen. The treatment of choice is going to be chemotherapy or radiotherapy. Especially for localized cases, radiotherapy may be a really good option, while for those cats that may have involvement of extranasal tissues or lymph nodes, chemotherapy may make more sense. In general lines, the response rates and the outcome for both options is pretty similar, with response rates as high as 75 to 100%. And sometimes we may even consider the combination of both radiation and chemotherapy. This is one of the studies that looked at cats with nasal lymphoma treated with a combination of radiotherapy and chemotherapy. And this study was published in Veterinary Radiology and Ultrasound in 2007. And they included 19 cats, all of them treated with radiation and 6 months of chemotherapy. And the main aims of this study was to look at the outcome. And interestingly, they found that the median survival time for those cats was of 31 months, which is more than 2 years. And they actually did very well. So despite some of the lymphomas or forms of lymphoma in cats having poorer prognosis or shorter responses to chemotherapy, is worth always individualizing each case, because certain forms of lymphoma definitely seem to be more responsive to treatment than others. And this is COP, one of the cats that we saw a few years ago, diagnosed with palpebral lymphoma. And she had also involvement of the nictitans membrane. As you can see, when she presented to us, she had this very swollen eyelid with this mass that was ulcerated and very crusty. This was around October 2017. So we basically got some biopsies, we confirmed the diagnosis of lymphoma, and we did staging. It didn't look like the lymphoma was anywhere else in the body. It was just localized in that right eye. And we started COP, that is the name of the cat, on a COP protocol. That it was a funny name for this poor cat. Anyway, the cat responded really well to COP protocol. So you can see that the palpebral lymphoma had a really good response, and just 1 week later, after the first dose of vincristine, that swelling and that mass had significantly reduced in size, and she had achieved a really good partial response just with the first dose of chemo. And we can see COP 1 month later with this eyelid that was back to normal. So the lymphoma was in complete remission after the induction phase of the protocol, so after that first month, and her eyelid was looking exactly like it was before. So we were very happy with the response that she had, and she continued the protocol, and she tolerated really well for a period of a few months. So we have now reached the end of this talk. I hope you enjoyed the presentation, and please do not hesitate to get in touch with us if you want more information about VetSpoke.